Hello, my name is Jill Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics. Today, I'm thrilled to be joined by Stephanie Neider, NMC's new dermatologist. We're pleased to be reintroducing dermatology to the community. So this is a great day to be introducing Dr. Neider to all of you. So Dr. Neider, welcome to the community.
Thank you.
We have been waiting for a dermatologist for quite some time, and it's such a huge need in this community. So everybody's going to be just so thrilled to have you here and have access to this service. So let's start off by talking about what is a dermatologist and what type of preparation that you have to become a dermatologist.
So a dermatologist is a doctor who takes care of hair, skin, and nails. I went to medical school at Ohio State University for 4 years. Then I did an internship year in Fresno, California, and I did 3 years of residency at Ohio State again. So I completed my dermatology residency at Ohio State in 2004. And then I've been out in private practice since then, and I'm thrilled to be here in Vermont now.
So how did you make your way to Vermont?
Well, we love skiing, we love the outdoors. The last 3 years we were in Cleveland because my husband was finishing his schooling there. And I just really wanted to get back somewhere more rural, somewhere more beautiful. And here I am.
That's wonderful. Now you're here with your husband, and you have children?
We have 3 daughters, 11, or actually the one daughter just had a birthday, so she's 12 now, 12 and 9 and 7.
Oh, wonderful, wonderful. That's terrific. So, what does a dermatologist do? So what type of services will you be offering to the community?
So we do a lot with skin cancer, skin checks, taking care of lumps and bumps on the skin, mole checks, skin cancer screening. Also, just anything that you get on any rash, acne, warts, psoriasis, itching of the skin, hair loss,
interesting.
Nail abnormalities. Anything on the outside of you, pretty much, I can take care of.
Wow. How interesting. So what's the most common thing that you expect to see?
Probably skin cancer screenings, acne, warts, rashes.
Now what about procedures? Things that you do in your office, procedures?
So I do every procedure I do in my office. And, I do skin cancer surgeries, skin tag removal, mole removal, acne peels and extractions, cysts, do a lot of cysts, little lipomas. I do photodynamic therapy, which is a treatment that we use for superficial skin cancers and precancers, but can also be used for acne and rosacea. I do phototherapy, which is a treatment that's used for psoriasis mostly. I do laser. So I have a laser which can help treat the little veins people get on their faces, little brown spots they get. Can also resurface and help with wrinkles and hair removal. I do of anything else.
That's pretty comprehensive. So you had mentioned what does that mean, and what do people expect
The
with that?
photodynamic therapy or phototherapy?
Yeah, well, I guess both of those.
Okay.
What does that mean, and what do people expect with that?
So photodynamic therapy, that is mostly covered by insurance for for early skin cancers and precancers, and that's a treatment where we put a compound called Levulon on the face, which sensitizes you to the light that we use. So it's taken up mostly by the cancerous cells, and then we let it incubate for about an hour, and then we put you underneath the light, and basically it targets the cancers. The light targets the cancer cells that have the levulon in them and destroys them. Yeah, so that you end up with, it looks like a sunburn for a couple days, and then it peels, and then your skin goes back to normal.
Wow.
Yeah.
I know so little about it, but you know, but that's pretty amazing.
It can also be used to shrink sebaceous glands. So it's also taken up by the sebaceous glands more than other glands in the skin, and so sometimes people get these little bumps on their face that are called sebaceous hyperplasia, or even acne. So one treatment for acne is shrinking the sebaceous glands, and this can do that. That generally is not covered by insurance, so that would be something that a patient would have to pay for out of pocket. But for the cancer indication, it is. So
let's talk about sun for a moment. I mean, and your recommendation about exposure to the sun. So folks can get discoloration of their skin, and is that something to be concerned about, or, you know, what do you think about sun exposure and what that can do to the skin, and how do we protect ourselves?
So there are a lot of just easy ways to protect yourself from the sun, just like sitting in the shade, wearing a hat. The more clothing you have on, the more you're protected. But of course, there's also sunscreen for those areas that you can't always protect. And you want to make sure you get a broad spectrum sunscreen with at least a 30 SPF. So a lot of people don't realize that SPF only refers to UVB, not UVA radiation. So that's why you also want to make sure that the sunscreen says broad spectrum, so it covers the whole range. So
that discoloration, like you might get a discoloration, is that
are you talking
from
about
the sun?
freckling
or
melasma?
like patching?
Are you talking about the redness of this, like how people get red around their neck?
Yes, yes.
Okay, that's called poikiloderma, and that is from chronic sun damage.
Okay.
And so definitely protecting your skin will prevent that. But also, I mean, you know, people get a lot of reds and browns in their face too from sun damage over the years. And you'll see that like right in their creases, they'll be whiter, but around they'll be redder, or like right underneath the lip, it will be whiter, but around where they got more sun, it will be redder. And that's, a lot of that's from sun damage too. And so if you want to keep your skin looking young and beautiful.
Yes, of course, we all do.
Putting on a sunscreen every morning as a base layer, and just being cognizant and careful with your sun exposure is important. So like this morning, I have sunscreen on my face right now. I'm not planning to be outside all day, but I'm driving to work. I'm doing all these little things, and I don't want the sun damage to accumulate. I'm trying to keep my skin looking as young as possible for as long as possible.
Well, it looks great. So.
Well, thank you.
So are there other prevention techniques that we should deploy?
Definitely staying out of tanning beds.
No tanning beds.
No tanning beds. That's a way to intensify the photo damage, is going in a tanning bed. Smoking makes the skin, because it tightens the blood vessels in your skin.
Okay.
So even when we're doing surgery on people, like when people get skin grafts, they're not supposed to smoke afterwards, otherwise the skin graft will die, because it decreases the blood perfusion to the skin. So that makes the skin look a little yellower and ages it faster.
Wow. There's so much to learn about our skin. And protecting it.
Yeah.
So how do folks get to see you? Your practice is going to be opening soon, and so what's the best way? Do we have to go through a primary care physician or self-referral, or?
You know, you probably know more about the insurance in this area. I know with like straight Medicare, you don't need a referral. I don't know how the Blue Cross, do they have really restricted networks, the Blue Cross?
So, I mean, I think that you could definitely contact your office directly, and they will actually talk with you about what insurance that you have and what the prerequisites. So I think it would be wise for people, first, they could certainly call their primary care or call you directly, and then they have folks that can actually talk about their insurance and what might be needed prior to that. So the good news is that everybody works so closely together, like the primary care providers and the physicians, that they really help folks move in the right direction and make sure they get the right coverage and the right steps in the process in order to to make sure your insurance is covering it.
So some people would be able just to call the office without a referral, but then other
Yeah,
people.
exactly.
And the best way to find out about your insurance is to call our office.
You bet. You
Okay.
bet. Now, where are you located?
So I'm going to be at 128 Fisher Pond Road,
Okay.
which is on top of Northern Valley Eye Care Center.
Okay. So where Dr. St. Marie and Dr. DeMarco,
Uh-huh.
you're going to be upstairs.
I'm going to be on the second floor.
Boy, it's a nice new building. It's
Yeah,
beautiful.
it is.
Nice space.
Yes, it is.
It's going to be beautiful. That's great. And you happen to have the number?
Yeah, it's 802-524-9707.
Okay, so 524-9707.
Yes.
Great. And I'm sure people are already lining up to see you because it's been so long since we've had a dermatologist, and it's been such a long wait time to get into Burlington. They're wonderful, but the wait time has really been excessive because when you're ready, you're ready. And so it's been long. So we're thrilled to certainly have you here.
Thank you.
So what do you do for fun, when you're not in the office? And I know you've got probably 3 busy children, but what do you do for fun?
I mean, I love to ski, so I'm hoping to do a lot of that this winter. I just love hiking, biking, and kayaking, and spending time with the kids and with my husband. Like to read a good book. So nothing too exciting.
Nothing too exciting. So have you, finding a home, are you settled in?
Yeah, we're living in Georgia.
Good.
So, yeah,
That's
enjoying
excellent.
that. Yep.
Good. And we've certainly having some wonderful fall weather for your arrival. So
Yeah, got to make some cider. Some of my neighbors yesterday. That was fun.
excellent, excellent. Well, it's really great to have you here. And I know that probably one question that folks are thinking about, do you do any cosmetic dermatology?
I do. So I do Botox, so for wrinkles on the face, and also the laser. So also acne scarring. I do some treatment for that. So, and peels. But
Now, what's peels?
like glycolic acid peels or salad, they just help smooth out the skin, thicken the collagen a little bit,
Okay.
even out the tone.
Okay.
Yeah.
Other things? I didn't mean to interrupt on the cosmetic side of things.
I think that's about it.
That's it.
Yeah.
Okay. All right. So is there anything I've missed? We want folks to know that you're here and what you do, and you've told us where you're located, and anything else that you would like folks to know about you? You're ready to see him, right?
Right. Well, I'm just really happy to be here, and I'm excited to get started and to start seeing patients again and to become a part of the community. And I've been really happy with working with Northwestern Medical Center. I think they're a great organization. They've just been really welcoming and very helpful, and I think they take really good care of their patients and their employees. So I'm happy to be here and be a part of you guys.
Great. Thank you.
Yeah.
Thank you so much. And thanks for getting out and meeting other physicians and letting them know that you're here, and really hitting the ground running so that folks are aware and you're ready to be an active part of this community. So thank you so much, and thank you so much for being a part of this show and letting folks know what dermatology is all about.
Well, thanks, Jill.
This is Jill Bowen, your host of the NMC Health Beat Show. Thank you for joining us this morning and welcoming Dr. Neider.